Hello, welcome back to my channel. My name is Iyabo. I am an international midwife working and living in the United Arab Emirates, UAE. Our baby is saying hello, sleeping as usual. As a midwife, when you find a midwife, you find a pregnant woman, and you find a baby. Yes, we are happy about it. Yeah, so today's topic is cervical incompetence. What is cervical incompetence? Before we do that, we have to know what is cervix. Cervix is found in the mouth of the uterus inside the woman reproductive organ. For any woman that has its uterus, definitely will find a cervix at the mouth of the uterus. So this cervix, when a woman is pregnant, supposed to be long and covering the mouth of the uterus where the baby will come out from at when the baby is full term inside the womb. That is the cervix. Cervix is always attached to the uterus and is long, supposed to be long, and it gets shortened from the when the woman is in her third trimester and when the labor is preparing. Okay. Cervical incompetence is now when they say something is incompetent, it's incapable of doing the function. So the function of the cervix is supposed to cover the uterus and make the baby to stay inside till when the baby is full term to come out. That time it will open. But in cervical incompetence is that it will open before time, and mostly it's happening around the 14 to 20 weeks. That's between, when we say between 4 months and 5 months, that's when it starts. It normally happen. That's cervical incompetent. And when it's incompetent, is that it will shorten. The function supposed to perform when the woman is about to deliver and the third stage. That's what it will be doing at early stage. And when it happen, it prone the woman to go into early labor or even to have a miscarriage in that at that stage. So cervical incompetence is when the cervix is dilating and allowing the content, which is the baby that is forming inside, to come out. Okay, what causes the cervical incompetence? Some naturally they have incompetent cervix. Some it can be due as a result of previous childbirth or even previous some procedure that have been carried out in the past in that woman's uterus. So it can be natural, it can be as a result of previous childbirth or previous procedures that have been done in that woman. So what are the signs and symptoms? Does it can when it happens, how will a woman know that her cervix is incompetent? Number one is that it will make the woman to have a pelvic, she'll be having pressure in her pelvic. She feel that there's something pushing down in her uterus, in her pelvic. She'll feel this pressure. And as I've said, it will happen between 14 weeks to 20 weeks. 14 to 20 weeks are in between 4 and 5 months. That's why it is important when the woman is pregnant, as soon as she discovers she's pregnant, she have to report to the hospital, because if she does not go on time, she could lose that pregnancy if the cervix is incompetent. So it's between 14 to 20 weeks. And the cervix, she will feel that there's a pressure in her pelvic. And again, she will have back pain. There will be back pain, the woman will feel back pain, and even sometimes abdominal cramp. She will feel abdominal cramp, and she can have some discharge from the vagina. She will have discharge. Sometimes it will come like showing like blood. You know what I mean? And then it could go as much as the woman having this forced labor, that she will be having early contraction. So those are the signs she will see, what she will notice before it will be discovered that the cervix is incompetent. How is it going to happen when the woman has cervical incompetence? The diagnosis, when she report to the hospital, there are ways of discovering that there's cervical incompetence. First of all, she will see her doctor, history taken. She will be asked some question, how she's feeling, what happened in the past, the present history, and her past history will help the healthcare provider to be able to discover, to diagnose her the cervical incompetent. And there will be physical examination. When she feeling pressure, they have to the health provider will touch some part in her body to know and if she's having any pain, the cramp in her abdomen, and even how she feel physically. And also will do an ultrasound. This ultrasound, the that will be done at this time, that will give a proper report, and to show what is happening to the cervix is a TVS, transvaginal scan will be done on the woman to know when how the length of the cervix. It will discover the length of the cervix, because there's amount of length the cervix should maintain when the woman is pregnant. So all this will be done in the hospital to discover or to diagnose cervical incompetence. Then what are the treatment when it is being discovered? Next thing is to treat, because every woman, when a woman is pregnant, most women, higher percentage of women, in as much as a pregnancy that is being planned, the woman want to get the pregnancy, she get that pregnancy. Even though some unplanned pregnancy, most women when they are pregnant is now becoming precious. They don't want to lose the baby. So whenever they mention the treatment, every woman wants to see how that pregnancy can be sustained. Then what are the treatment? Treatment can be by cervical circlage or by progesterone. They will give medication. That's medical will give a medication or cervical circlage. This will be done also in the hospital, where a medical provider, that's the obstetrician, will be giving some surgical intervention. This is just a minor surgery that will be done on the cervix to close, to do some stitch, to put some stitch on the cervix, which will help to retain the baby till the baby is in full term. And she'll be given some medication injection form, where, or even the one they will be inserting to keep the baby in the womb and to maintain the service, for service to maintain his length before the baby is 10. So when a woman has sacrilege, she will have more appointment, and by 36 to 37 weeks, the sacrilege will be removed, so that when she goes into a labor, there won't be any obstruction to make the cervix to dilate, because at that time, that's when the cervix is needed to dilate. And when it's dilating, it's shortening and going back to meet up, to attach back to the uterus. And sometimes even the woman, if she has not reached 36 weeks, but she start leaking, she starts the baby, there's a water that covers the baby in the womb. When that water that's covering the baby, which is the amniotic fluid, start coming out, in such case, the woman also, the sacrilege will be removed. But most time, the woman will be on bed rest for some time, and if properly managed, the woman goes and finally gets to the full term, where she will deliver her baby. Cervical incompetence is not something that is happening to all women. When you have about 100 women, one of them will have cervical incompetence. So it's not something that is really common, but when it happens, it can be really threatening, because the woman may lose her pregnancy, resulting into unhappiness to her and her family. So it's 1 in 100. But most importantly, before it can be diagnosed, the woman have to be in the hospital. And sometimes you see some people having recurrent abortion. It could be as a result of cervical incompetence. We have so many reasons why a woman can be pregnant and be losing her pregnancy, but cervical incompetence is one of them. So this is advised that when a woman is pregnant, she need to go to the hospital, even though she do the pregnancy test at home. As soon as she confirm that is pregnancy, she need to visit the hospital where proper and medication will be started. And this will bring us to the end of today's topic. Baby, say thank you for watching. Thank you all for watching. For those that have subscribed to this channel, I want to say a big thank you. And if you are watching and you are yet to subscribe, what are you waiting for? Subscription is free. Subscribe to my channel, and I will see you all in my next video with an interesting topic.